Hey guys, so really exciting news. I finally have my top surgery date, but in this video I'm going to talk about how my consultation went and how my pre-op went, which I had straight after. I've previously done a short consultation video, but this time I had it with Dr Kneeshaw, the surgeon that I asked to have. So a bit of an update on my top surgery. So I just had a phone call from where I'm going to have top surgery, the breast unit. I don't know if I mentioned this in my last video when I had my consultation, but I had this with Dr. Wool. I went on the waiting list to have my surgery with Dr. Kneeshaw. Now, I did email about this like centuries ago, months and months ago. Obviously, I've had no reply because gender clinic take forever to reply. But when she called me, she basically called me. I got a call to be asked if I still wanted, because her words, I've been on the waiting list for a while. So she called to double check that I still wanted surgery. I was like, yeah, 100%. And she was asking if I minded going with any other surgeon. I'm assuming because other surgeons have shorter wait lists. So I took an opportunity to ask about why I wasn't on Dr. Kneeshaw's waiting list and how come I'd been seen by Dr. Wheeler. And she basically explained that they're part of the same team. So I was referred to his team, which is why I was seen by Dr. Wheeler, and the results would more or less be similar. So I've now asked how long Dr. Kneeshaw's waiting list is and if switching to his waiting list, because I'm certain that I like his results. If it would take much longer, because I would prefer to get surgery by someone that I feel that I trust. So yeah, that's the latest update. Just at the moment, she said, to be honest, it's looking good. She said in the next week or so I'll hear back about waiting list, and if Dr. Kneeshaw's list is about the same as Wooler's, then I'll definitely go and get it done by Dr. Kneeshaw. In my last video, I had a consultation with Dr. Wooler, which is part of Kneeshaw's team, but I asked to be referred to Dr. Kneeshaw's waiting list. So I've now finally had my consultation with Dr. Kneeshaw. I ended up having my pre-op straight after, so I'll be talking about details on what happened in my consultation and my pre-op. I went into this with a lot of questions about surgery, recovery, how to prepare. All my questions were answered in these appointments, and then I will be talking briefly about surgery. And once you've had your pre-op, you can actually know more or less when your surgery is going to be, and I'll talk about this in detail in a sec. What happened when I went into the consultation with Dr. Kneeshaw? So initially he touched my chest just to see what kind of surgeries I'd be eligible for. He measured my chest, saw how much breast tissue I had. He asked about my medical history. He asked if I smoked, things like that. So after he did his assessment, he actually said something that I'd been dreaming I would hear for a really long time. But the outcome ended up being different to what I always thought it would be. So he actually said I was eligible for peri. So peri is a surgery that leaves really minimal scarring. The two most common forms of surgery would be double incision, where you get the two kind of scars around your chest. Whereas with peri, they do the incision around the nipple and tighten your skin around there. Put pictures up so you can see the difference. But it leaves really minimal scarring, and that's the surgery I always kind of wanted to have, and it's the reason I started working out my chest so intensely as I did years ago, so that hopefully my chest would be small enough for this. But basically said I was eligible for peri, which was amazing to hear, but he then said, however, your nipple placement will be lower than it should be because of how the surgery works. You don't really get much option on where things go. It's to do with where your anatomy is. And he then also said that I'd probably need another surgery later on to reduce nipple size, because it's likely that nipples would stretch after this surgery. Then he went on to say that with double incision I would have almost perfect results because my chest is so small and my pecs are so defined. He said he'd be able to place everything very perfectly. He read me a long list of risks, but he said I had very, very low risk of any of these risks happening to me. He said I'd have very low chance of dog ears. If you know what that is, it's when you have a bigger chest, you can end up with a bit of excess skin on the side, which then can be sorted out with just a bit of liposuction or another small surgery. He then explained how surgery with him works. His surgery lasts about 2.5 hours, and then you can expect to stay overnight for 2 days at his hospital. You can then choose to go home or stay in a hotel nearby. But 9 days after surgery, you then get your drains taken out, and then they expect you to wear a support garment around your chest for 6 weeks after surgery. You cannot do any heavy lifting for 6 weeks after surgery, but you can return to light desk duties after 3 weeks. So you have to have really intense care for the first 3 weeks, but then for 3 weeks after that, you can start moving around, looking after yourself again, but you can't go back to the gym until at least 6 weeks after surgery. So usually your consultation can be any time before your surgery, so your consultation isn't really an indicator that your surgery is coming up. So my initial consultation was around a year before my expected surgery date. However, because I changed surgeons, it ended up falling on the same day as my pre-op. I asked them a few questions I had about surgery that I was a bit nervous about. I'm really nervous about needles, and I know for surgery you have to have a cannula because that's anesthetic. And I asked if there's any way I could be knocked out before the needle went into my body so that I wouldn't be as anxious or freaked out about it or like feel it. He recommended using almond cream. So they put a cream on your hand and then you don't feel the needle going in. I heard about gas because they still use gas in the UK. And he said that is an option, like you can be knocked out before the needle goes in. But he said it kind of makes you a bit disorientated and it's not the best experience. And he recommended that if I'm anxious, almond cream would be the best solution. And for me, as long as I don't feel it, I'm happy. So I opted to probably go for that on the day. But you don't have to decide this until the actual day of the surgery. I also asked if taping would affect my surgery, and he'd said this close to surgery, not really. Then I had questions about nipple sensitivity, and he told me that because double incision, you get nipple grafts and your nipples get reattached. He said I was definitely going to lose nipple sensitivity. He said the only chance that it will come back is if the nerves go back over time. And then with recovery, I've briefly covered this at the start, but if you have any questions, feel free to leave them below. And then at my pre-op, so what that happened was I had some tests done to me, had some swabs done to me, and I had a blood test. The great news about your pre-op is that your surgery has to be done within 12 weeks, within a 12-week window of your blood test being done. So if you're having a pre-op, you know that your surgery is going to be in a random day within 12 weeks. After I had my pre-op, a couple of days later, I actually got a phone call giving me a couple surgery date options, and then I picked the one that was best for me. And that is officially my surgery date. So my top surgery date is the 27th of March. And this is really great because this will be about a week after my 3-year anniversary on T. The best tips I have for you to have the best top surgery results you can have: work your chest out as much as you can. I've been working out for about 3 years now, about 3 to 5 days a week, and I've been putting a lot of focus on my chest, making sure that I have a really good set chest routine. This has helped over the last few years really build my chest muscles, and when I've been to both consultations that I've been to, I've had remarks made about the size of my pecs and how this would really help surgery results. This has really helped reduce my chest size. It also helps with nipple placement quite a lot if they can really see where your pecs are. The next video you'll see will be an educational one, and then after that you'll probably see a blog where I'll bring you with me to my top surgery. So if you have any questions about this, comment them below.